Um, so with our blood vessels, we have arteries and veins. Okay, arteries carry oxygenated blood away from the heart. Okay, your arteries carry blood away from the heart, and your veins carry blood to the heart. Okay, your veins will carry blood to the heart, and it is deoxygenated blood. Okay, if you reference the heart, okay, if your heart is the starting point, arteries and things in the artery family are carrying blood away from the heart to the body. Okay, so from the heart, it's going to go through arteries, and then your arterioles, and then into your capillaries, and this is where we get oxygen to be delivered to tissue. And then those capillaries will drain into the venules. So these two things are the same size, okay? So capillaries and venules are pretty much the same size, but now we're in the vein family, which means this is mostly deoxygenated blood. So now we are returning to the heart. So it goes from the venules and then to the veins, then to your great veins, and then finally back to the heart. Okay, so that's the cycle. Okay, we have 3 layers to our blood vessels. Okay, we have the tunica intima, the tunica media, and the tunica externa, also known as the adventitia. That I think is listed. Okay, well, let's write it in. Okay, the adventitia. Okay, so adventitia and externa are AKAs of each other. All right, so the inside most lining of the blood vessel is, it's supposed to be smooth. Okay, it is made of endothelial tissue, and it's supposed to be smooth, and you want it smooth so that the blood can flow easily through it. Okay, the next layer out, the middle layer, is the tunica media, and that is smooth muscle. All right, so your tunica media, or that middle layer, is smooth muscle. Okay, so your arteries have the ability to expand and contract because there's some muscle in there. And then the outside layer is the tunica externa. Okay, this is a tough material which gives the blood vessel its integrity. So they're fairly hard to tear because that tunica externa is pretty tough. Oh, there it is, tunica externa, or the adventitia. Okay. All right, so from this page, the tunica intima, know that it's the innermost. It's made of endothelium, provides a smooth surface to allow blood cells to flow freely without being damaged. Okay. It helps to prevent blood clotting, and it helps to prevent platelet aggregation. Okay, remember, if you have platelet aggregation, that means all the blood or the platelets are starting to clump together, which means it can form a clot. Okay, so the smoothness helps prevent platelet aggregation. The middle layer is the thickest, and it is made of smooth muscle. And the outermost layer is a tough tissue, which gives the blood vessel its integrity. Okay, and then it does allow it to give rise to other capillaries. So if you have a tube and another tube and tissue, there are some branches that come off, little capillaries that come off, and they can communicate, send blood to one another. Okay, so you will get a rise in capillaries through the outside layer of that tunica externa. Okay, vasoconstriction means the blood vessel gets really small. Vasodilation means that blood vessel can get really big. Okay, so when it constricts, it gets small. When it dilates, it gets big. And these can go back and forth. Okay, it depends on what your body needs at the time. So it's normal for blood vessels to constrict and blood vessels to dilate. And all that is autoregulation because of smooth muscle. So an example would be if you get really cold, to conserve heat, the blood vessels will constrict. If you get really hot, to allow heat to escape, the blood vessels will dilate to allow heat to escape. Okay, arterioles are similar to arteries. They're just smaller. Okay, it's also innervated by the sympathetic nervous system, which is your autonomic nervous system. Okay, it has the ability to constrict and relax because of the smooth muscle. And then the really skinny tubes are the capillaries. Very, very tiny. They are the smallest in diameter of all the blood vessels. They are made of a single layer of epithelial cells. The advantage of a single layer is it allows for exchanges of, gases like oxygen, carbon dioxide, okay, and anything else that needs to exit the capillaries. Things can exit through the capillaries very easily because it's a very thin layer of tissue. It's a single layer, squamous epithelial cells. Okay, capillaries do have the ability to shunt or open. So in other words, ever notice if you get really cold, the first things that get cold are your fingers and your toes? All right, because your capillaries are literally shunting blood to your fingers and to your toes to try to conserve heat for your core. Okay, so innately speaking, if you're starting to get cold, your body says, well, the heart is more important than the fingers. The brain is more important than the fingers. So I'm going to conserve heat by shunting blood to the fingers and toes so that my core stays strong. Stays warm, okay? And so if you keep going in that direction of being too cold, then you risk frostbite, right? So that's why people, when they get frostbite, usually the first things that get hurt are the tips of your fingers, the tips of your toes, and your nose and your ears, okay? And then if it gets really bad, then it can be the whole foot or the whole hand, your cheeks, and then it can just keep working up the arm, okay? And that's if it gets really bad. And that's because there's no more blood supply going to the fingers and whatever because of the shunting of blood. So some of those things that capillaries exchange, gases and nutrients, waste material, okay? And they do that in 3 ways: direct diffusion. Okay, so things like gases can diffuse easily across a membrane. So diffusion of molecules. Gases, oxygen, nice and easily goes directly across, okay, direct diffusion. Diffusion through a cleft, right? A cleft. So there's a little tunnel, a little passageway that you can see there that things can go through, and or through a pore, okay? So a bigger opening area that once it does open, things can pass through. Like, for example, a white blood cell, okay? So a white blood cell is a type of Pac-Man, and it does have the ability to leave the bloodstream and go through the capillary to the site of injury. You know, like if it's a bacteria or whatever, these Pac-Mans, which are your white blood cells, they'll go and destroy it. Okay, so some of the arteries that I want you to know. Okay, first of all, you see the red. The red is letting you know it's oxygenated, and therefore it's in the artery family, okay, which means it's going away from the heart. Okay, so that's why they show you red. If you see blue, then that's letting you know it is, so here's an example of a blue blood vessel. That's letting you know it's a vein, and the blue represents deoxygenated, okay? So, okay, so some of the blood vessels I want you to know is the carotid artery. Okay, the carotid artery in the neck. The 3 branches off the aorta. The 3 branches off the aorta. Okay, going from right to left. Okay, because that's the direction of blood flow. So blood comes out of the heart and kind of does this U-turn. So it's going from right to left. Okay, that would be the brachiocephalic, the left common carotid, okay, and then the left subclavian. All right, so brachiocephalic, right, left common carotid, and then the left subclavian. Those are the 3 branches off of the aortic arch. Okay, the names give it away, right? So brachio, so as you can see, that means it's going to the arm. And then the cephalic part means it's going to send blood to the brain. All right, so sometimes these, you know, when we name these blood vessels, they're named after where the blood is going. So like your armpit is the axillary area. So the blood vessel is the axillary artery that's in the armpit area. Okay. This one is the subclavian, which means underneath the clavicle. So your clavicle bone is here, and this particular artery happens to travel underneath the clavicle, so they call it the subclavian. Okay, so subclavian, axillary, the brachial artery inside your arm there. Okay, this is the brachial area on your surface anatomy stuff. That's your brachial area, so that's the brachial artery. Okay, then it splits into the radial and ulnar artery, and those follow the bones. So the radial bone is on the thumb side, and the ulnar artery is on the pinky side because that's where the ulnar bone is. Okay, so those tubes are named after the bones that they follow, radial artery and ulnar artery. Okay, so aorta, aortic arch, okay, aortic arch, which is literally that arch part. Okay, then you have the downward part, which you might read descending aorta or thoracic aorta. So descending meaning it's going down, and some authors use thoracic aorta. Okay. If you keep going, you will bump into once it crosses, once the aorta, once that tube crosses the diaphragm, okay, once the aorta, the thoracic aorta, goes through the diaphragm, it turns into the abdominal aorta. Same tube, just different name. Okay, these are all one long tube, and these tubes give, they branch and then they branch again, and then depending on their location, then we change the name. Okay, so once we get through the diaphragm, now we're in the abdominal area. Now it's the abdominal aorta. Okay, then about the level of the belly button, it splits. Okay, the abdominal aorta splits into what's called the common iliac. So this is the left common iliac, and there's the right. Common iliac. Okay. And then right here, so that common iliac, and then it splits again. There's another one called the internal iliac. And if you have an internal, you have to have an external. So there's the external iliac. Okay. So if we draw it out, there's the split right there. Okay, the inside one that goes to internally, that's the internal iliac, and the external one is the external iliac. Okay, you have the femoral artery. And then behind the knee, it's hard to tell from this picture, but behind the knee, that's the popliteal artery. Okay, behind the knee, that's the popliteal fossa. Behind your knee, that is the popliteal fossa. Okay, then from the popliteal fossa, then you've got the, this is the tibia bone, okay, the tibia bone. So in front of the tibia, that's the anterior tibial artery, and behind it is the posterior tibial artery. And then the artery that's on top of the foot is called the dorsal pedis. Remember, this is the dorsal aspect of the foot. So the artery that's in that area is called the dorsal pedis. Okay, from this one, I want you to know the vertebral artery. That artery passes through the cervical bones, as you can see there. Passes through the transverse foramen in the cervical bones. That's the vertebral artery. Okay, from this one, I just want you to know that the blood supply to the brain is called the circle of Willis. Okay, the blood supply that goes to the brain is called the circle of Willis. And that's all the red stuff you're seeing there. So if a person gets a stroke, okay, that means this clot got stuck maybe like right there, part of the circle of Willis. And if that's where the blood clot, the stroke happened, then all of that tissue that innervates that part of the brain dies. And so therefore, that's the part of the body that will manifest signs and symptoms. So in the stroke family of things, the more distal the stroke, it's not as fatal, okay? So if you're gonna get a stroke, the more distal you can have the stroke, the better, because it does less damage. Okay, the deeper the stroke, like right there, man, if that's where the clot landed, then all of that dies. That's massive. That's horrible. Okay. So just keep in mind with the circle of Willis, the more distal the stroke, the less damage, the more central or the deeper the stroke, the worse the damage. Okay, these are just we looked at this on the anatomical man. Okay, veins have one-way valves in them. Okay, veins have one-way valves in them, and they are designed to, the muscles must contract in order to squeeze on the vein to force the blood toward the heart. Okay, so in other words, in the artery family, the heart pumps the blood through the arteries to the body. In the vein family, it relies on muscle contraction and movement to get the blood back to the heart. And to help, the veins have these one-way valves in them. Okay, so the veins to know. All right, since veins work toward the heart, let's kind of work backwards, so to speak. Okay, for veins, this is normal, meaning that's just how they work, because blood flow goes from the body back to the heart, so it kind of works backwards compared to the arteries. Okay, so all right, so you have the the great saphenous vein, okay, which is the longest vein in the body, the great saphenous vein. You have the popliteal vein, which is behind the knee. Okay, the femoral vein, because it follows the femur, right? So here's your femur bone. And the big blood vessel that follows the femur bone is the femoral vein. And these veins on this animation are blue to let you know it's deoxygenated blood. Okay, then the femoral vein will drain into the external iliac. Okay, and then that one drains into the right and left common iliac. Okay, continuing to work toward the heart. Then we have the a major blood vessel in your abdominal and thoracic area, okay, called the inferior vena cava. Okay, so that is that, whoops, that is that big tube, that big blue blood vessel that works to the heart. Okay. Then we have the superior vena. Well, let's start working toward the heart. So let's go more distal than that. Okay. Okay. Then you have the external and internal jugular. Okay. So the external and internal jugular vein, and those will drain into the left brachiocephalic, okay, which is right there. And then there's the other brachiocephalic. Okay, so from the head as we come in, it's the jugular that drains into the brachiocephalic vein, and then eventually the superior vena cava. And then that goes into the heart. Okay. Then from the arms, as we work toward the heart, okay, you have the radial vein and the ulnar vein, and then the median cubital vein, which, by the way, that's a common site to draw blood. The median cubital vein, very, very common site to draw blood. Okay, continuing toward the heart, the median cubital vein drains into the basilic vein. Okay, and that's kind of on the inside of the arm there. The vein that's on the outside of the arm, that's the cephalic vein. Okay, so the cephalic vein is all of that right there. Okay, continuing toward the heart, then we have next the subclavian vein. That is a vein that's underneath the clavicle. And then The subclavian will drain into that brachiocephalic and then into the superior vena cava. Okay. Common sites for checking pulse, okay, is the carotid artery, the axillary artery, radial artery, and femoral artery. So those are very common sites to feel a pulse. Okay, it is, you know, at first it's difficult, but if you do it over and over and over again, you'll eventually be able to feel the pulse in the popliteal artery, which is behind the knee. And then you can even palpate to feel for the dorsal pedis artery. Okay, now lower extremity palpation for a pulse is sometimes utilized, the most common being the radial and the carotid. Okay, but there are some conditions that from the waist down, they will go out of their way to palpate, you know, the popliteal artery and the dorsal pedis. Okay, like diabetics, for example, or people with certain lower extremity neuropathies. Okay, laminar flow. Now inside of a tube, okay, so now we're inside of a blood vessel. You have laminar flow and turbulent flow. All right, what we prefer is laminar flow. And what that means is the blood is going through nice and easy. It's smooth and continuous, laminar flow. When you have turbulent flow, okay, when you have turbulent flow, the blood vessel is getting squeezed. It's becoming more constricted. So what happens is when the fluid is going through, it hits the constriction and like starts to bounce backwards. Hits the constricted area and actually starts to bounce backwards. That's called turbulent flow, and you can actually hear that through a stethoscope. Okay, if it's bad enough, you can hear turbulent flow through a stethoscope. Okay, now this will get into blood pressure, because what we're actually trying to do with blood pressure is squeeze the tube enough with the blood pressure cuff to literally kink the tube, and as you open up the blood pressure cuff, okay, so you're going from so if we take this tube and you squeeze it, you know, kind of like a straw, go ahead and pinch the straw, you're going to flatten it out. Okay, because you squeezed it so hard, it's now flat, which means fluid cannot go through it. Okay, as you start to release the blood pressure cuff, the tube, which is super flat, opens up a little bit more, opens up a little bit more, and finally gets back to normal. And you can hear this. That's called Korsakoff sound. The Korsakoff sound is produced because you created a turbulent flow on purpose with the blood pressure cuff, squeezing the tube, which inhibits blood flow. And as you gradually open it up, you're allowing fluid to now drain back into the tube. and you can hear this, okay? So the first sound that you hear, okay, is the systolic. Okay, it sounds like a drip sound. It goes bloop, 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 bloop. Okay, and you can hear that through the stethoscope. With the tube completely flat and blocked, you can't hear anything. But as you open up the tube, you're starting to reintroduce blood into the tube. The first drip sound, and that's what it sounds like. It's like a bloop, you know, almost like your sink faucet, you know, that dripping sound. The first sound that you hear, that's systolic. And you may hear that around 120 millimeters of mercury. So that's the systolic. And then as you continue to open the tube, so we went from super kinked, it's a little bit more open, a little bit more, now it's wide open. At some point, you're going to go back to laminar flow, which means you're not going to hear anything. So the very last sound that you hear is diastolic. And let's say you heard that at 80 milligrams of, or millimeters of mercury, because this is the units we use for blood pressure, millimeters of mercury. Okay. So we have now your systolic over diastolic. And if it's relatively normal, it'll be like 120 over 80. You know, maybe in another person, it's like 126 over 82. If they have high blood pressure, it's like 160 over 96. Okay. So the first sound you hear, systolic, and the last Korsakoff sound you hear, that's the diastolic. Okay, so we measure in millimeters of mercury. Hg is mercury on the periodic table. Okay, so you use a blood pressure cuff, which is called a sphygmomanometer. Okay, that's the fancy name for it. It's a blood pressure cuff. And what this does, it just describes on how you put it on the person's arm, and then how you so how you put it on, pump it up, and then release the pressure. Okay, so that's what that page is describing. Okay, here's a couple of important things I want you to know there, because it's a concept, it's an idea, and it helps you understand where a person's at. Okay, now think about this. If you have a heart, which is a pump, okay, and it has to push fluid through a really big tube. If the pump has to push fluid through a really big tube, that does not take a lot of pressure because it's a big tube. If the tube gets smaller, then the pump has to work harder. The pump has to work harder to push the fluid through the tubes. So if a blood vessel dilates, the resistance of blood flow decreases. There's not as much resistance. It's easy. It is easy to pump fluid through a big tube. Easy to pump fluid through a big tube. As the tube gets smaller, the pressure increases. Okay, the pressure increases, and so the heart has to work harder. So there's your increased blood pressure. Okay, so one more time, if you have a really big diameter tube, you have lower pressure, low blood pressure. If you have a super skinny tube, and by the way, these tubes are your arteries, and this is like literally your entire body. Like if all the tubes in your body are nice and open and healthy, low blood pressure. If the tubes get super skinny, then you have high blood pressure. And the heart has to work harder to pump the fluid through a skinny tube. Another thing that affects blood pressure is the thickness of blood, so the viscosity of blood. Okay, so viscosity of water is 1.0. So you all can imagine how how thin water is. Okay. And so blood has a viscosity of 3 to 4. So it's a little bit thicker. It's a little bit thicker than just water. Okay. All right. So as long as your body has normal viscosity, your blood pressure is fine. But if your blood thickens, let's say the blood gets up to 8.0 in viscosity, okay, that's really thick blood. So now the pump has to work harder, so that increases your blood pressure. And sometimes people's blood thickens too much, usually because of diet and lifestyle. Usually because of diet and lifestyle. Okay, another thing that can increase the viscosity of blood is you just have too many red blood cells. You have too many red blood cells. That can increase the viscosity. You might have too much plasma in your too much protein in your plasma. Okay, you might have too much protein in the plasma. That increases the thickness of the blood. Okay, so as viscosity increases, the workload of the heart also increases. And if it stays there, then you're going to start to get heart problems. Okay, from this one, this is the one I want you to know, Laplace's law. And this is what we talked about earlier. Laplace's law is saying if the tube is super skinny, the pressure goes up. The heart pressure and the load and how hard the heart has to work goes up. If the tube is really big, then the pressure goes down. So the force that the heart has to do depends on the size of the blood vessel. If it's super skinny, the heart has to work harder. If the blood vessel is nice and big and open, then the heart doesn't have to work as hard. Okay, mentioned this earlier with capillary exchange. That's simply material, gases, steroid hormones, fatty acids, amino acids, glucose, able to go through the capillaries. Okay, don't worry about this one. All right, we mentioned earlier the capillaries have the ability to shut off. That's by this precapillary sphincter. So this tourniquet, so to speak, this naturally built-in tourniquet that is smooth muscle called a precapillary sphincter has the ability to squeeze down, like you're seeing here, which decreases blood flow to that area. It's like a built-in tourniquet. Squeezes down if the body feels like it needs to. Okay. Sympathetic stimulation. Okay, here's what that means. All right, you have your sympathetic nervous system, which releases epinephrine, norepinephrine. And that, when it communicates to tissue, it tells you to be in stress mode because it's your sympathetics, because it's epinephrine, norepinephrine. Okay. So if the epinephrine, norepinephrine lands on alpha androgenic receptors, the blood vessels constrict. They get small. If they land on beta receptors, the blood vessels open up. So when you're in sympathetics, your stomach, your digestive system kind of shuts down. So those tubes get really small because they have alpha androgenic receptors, which causes vasoconstriction to your gut. So when you're stressed, when you're in sympathetics, your body is not worried about digesting food, so it shunts blood to the stomach. But to your muscles, right, to your muscles, and you're in sympathetics, it will open up. Lots and lots of blood will go to muscles. Okay, changes in pressure. Okay, so some short-term regulations in pressure would be through your baroreceptors and your chemoreceptors. Baroreceptors respond to actual changes in pressure. For example, if you are scuba diving and you go deep underwater, there's a pressure change and your heart will adapt because of your baroreceptors. If you go up in altitude, you go up to 14,000 feet, you're going to have changes in pressure. Okay, so this all depend, even if you go from laying down to standing up, there's a change in pressure. And your body will adapt because of the baroreceptors. Okay, so that's one way that your blood pressure will change, is if you have a change in pressure. Another way it'll change is if you have chemical changes. So your chemoreceptors are sensitive to chemical changes such as oxygen, carbon dioxide, and pH. Okay, these are located in your aortic arch and the carotid sinus. So in other words, your baroreceptors, the nerves are located in the carotid sinus and the aortic arch. And it communicates through cranial nerve 10, the vagus nerve. Okay, communicates through cranial nerve 10. All right, so from the aortic arch to the brain, cranial nerve 10. And then from your neck, which is where the carotid is, that communicates through cranial nerve 9. Okay, so cranial nerve 9, cranial nerve 10 are the nerves responsible for helping you interpret the pressure changes. Okay, the adrenal medullary mechanism, here's what happens. When the adrenals kick in, your tubes are going to go from a small diameter tube to a large diameter tube very quickly. Very quickly. So there is a substantial decrease in blood pressure. Because remember, if the tube is really big, it doesn't take much pressure to push fluid through the tube. So adrenal medullary, your blood vessels went from, the diameter was skinny and then they opened up real big. So you're going to get a decrease in blood pressure. Okay. So this usually happens when you exercise. If you think about if you exercise, right, the blood vessels dilate. More blood gets to the muscles and all that, to the lungs. Okay, so that's your adrenal medullary mechanism. Now, sometimes pain can cause this. So a person can have an all of a sudden increase in pain, which your tubes went from skinny to very big very quickly, and you can pass out. Okay, the drop in blood pressure is so much, and it happens so fast because it went from skinny to big. The drop in blood pressure can actually have people pass out. Okay, the chemoreceptors are the same thing. From the aorta to the brain, cranial nerve 10. From the carotid to the brain, cranial nerve 9. That's how they communicate. Okay, from this one, what I want you to know is the ischemic response. Ischemia means decreased oxygen. Decreased oxygen. If the brain and the spinal cord start to get decreased oxygen, okay, the first thing that's going to happen, you're going to pass out. Now, the brain is very sensitive to a lack of oxygen. And in some cases, if this continues, okay, with decreased oxygen and increased carbon dioxide buildup, it can be fatal. Okay, so sometimes this is an emergency situation. Okay, but in general, for most of us, non-emergency, sometimes things just happen where you end up having decreased oxygen to the brain. Like, for example, let's say you're sitting down in a catcher's position, like a baseball's catcher's position. They're kind of squatting like a baseball catcher, and then you stand up real quick. That's a massive change in pressure, and sometimes it's so fast, you kind of get dizzy. You're like, whoa, and you start to see the spots, and then your eyes kind of go a little black, and then you could pass out. Okay, because the change in pressure was so quick, the brain had decreased oxygen, very sensitive to it, so it'll just pass out. You'll pass out. Okay, that's in response to ischemia, which means decreased oxygen. Okay, the kidneys are involved with long-term regulation of blood pressure. Okay, so keep this in mind. The kidneys have a lot of functions, okay? A big one is purification. The kidneys are responsible for making sure your body is purified. It's a big filter. Another one is Regulation of blood pressure. The kidneys are good at regulating your blood pressure. So if you have healthy kidneys, your blood pressure is going to be fine. If a person has high blood pressure and it's chronic and reoccurring, and you have to investigate, why does this person have high blood pressure? Well, you could ask yourself, well, is their blood too thick? Are their blood vessels too skinny? Okay, they're supposed to be open, but they're not. They're too skinny, which increases blood pressure. Or is it the kidneys? Does this person have a kidney problem contributing to their high blood pressure? Okay, one of the mechanisms that the kidney does to help with regulation of the blood pressure is the renin, angiotensin, aldosterone mechanism. Okay, and I posted that video, and then I'll post it again on Canvas. Okay, but what ends up happening is renin is released from the kidney. Okay, it communicates with aldosterone. Wait, hold on. It communicates with angiotensin, which comes from the liver. Okay. And when these two combine with other cascade of events, eventually you get a change in blood pressure, which actually increases blood pressure. So that your kidney is part of long-term regulation of blood pressure, and it uses renin and angiotensin to do that. Okay, don't worry about, whoops. Don't worry about that one. This one we talked about on the endocrine system. Okay, hypertension, which is high blood pressure. Okay, what I would like for you to know is that normal is about 120/80. Okay. If a person starts to drop below, if they get too low, okay, let me make that better. If it gets too low, and this way we'll go too high. So let's say it goes down to like 80/60 and below, that's not good. And over here, if they're at 140/90 and higher, that's not good. Okay, couple heart conditions. Arteriosclerosis is hardening of the arteries, and atherosclerosis is lipid deposits on the walls of the artery. The lipids and the calcification, not good. Okay. We'll go ahead and stop recording on that one, and I'll get that